next up we have Thomas Nordgaard Dahle. I checked with lunchtime how to pronounce his name, who is a Redningsmann, a helicopter crew member, rescue specialist. He's over 29 years of experience in pre-hospital emergency care, including 16 years with the Air Ambulance as a rescue specialist and helicopter crew member with I can't pronounce this, Luftambulanse, I don't know, Norwegian Air Ambulance anyway, based in Norway. He's a registered EMT and a nurse with specialization in both anesthesia and intensive care nursing. He's trained firefighter through the Norwegian Fire School. His work includes research. He has a PhD thesis comparing methods for reaching patients and comparing particularly fixed line versus hoist operations and outcomes. So I'm excited to hear something about that. I think he's going to talk about that tomorrow. Where am I going here? This is important. In Norway, people are getting more outdoorsy, and doing extrication from difficult environments is getting more important. So hence his reason for studying this thing. So if you'd like to come up, that'd be great. Thanks, Thomas.
First of all, again, my name is Thomas. I actually now have been working 17 years in Norwegian Air Ambulance. So first of all, I just want to paint a picture of you how the Norwegian HEM system, helicopter emergency service, is functioning. So Norway is a small country if you compare it to Canada, but it's geographically long, and with the distribution of the population is in rural area and urban areas. The coastline, we are second largest coastline in the world, only beaten by Canada. And the population is about 5.5 million. So we're not a large or huge country, but we win a lot of gold medals in the Olympics. So I had to say it. But in Norway we have the HEM spaces. They are spread all over the country. We have 13 bases. We are 14 helicopters on call 24/7. The HEMS is a part of a tender with the health department in the Norwegian government. So that's a tender or contract which is coming out each year for 10 years. But now actually they have made that company I work in have the contract for another 10 years without a tender. So that was pretty good. The other thing is that we also have search and rescue in Norway. We have 7 bases of search and rescue in Norway. The search and rescue in Norway is partly civilian, and the Air Force have also some bases. The fleet in Norway consists, when it comes to air ambulance, consists of the Airbus 145 and the 135, and we have also the Augusta 139. The Air Force fly the Leonardo AW101. I think the Canadian also, you call it the Merlin. I think also you got it. And the civil part of the search and rescue fly the Sikorsky S-92. So the crew in Norway consists of a pilot, a HEMS technical crew member, and he introduced me as a Redningsmann or a rescue man, but the correct term, according to EASA, I will explain what EASA is HEMS technical crew member. So I will talk about the HEMS technical crew member. And he should be either a paramedic or a nurse. Then we have the physician. He has to be a specialist in anesthesia. That's a Norwegian standard that you're not allowed to be an emergency physician. You have to be a specialist in anesthesia. So as a HEMS technical crew member in Norway, we have 3 different roles. My first role is to assist the pilot during flight ops. The next supporting role is to support the physician when it comes to the treatment of patient. And the last role I have is to take the lead when it comes to rescue mission. So we conduct the rescue mission correct. So for me, working as a HEMS technical crew member in Norway is actually interprofessional practice in real life. And this picture is actually me and my brother. My brother is a pilot, so we actually have been working together on the same shift. Not so much more because the CRM was pretty bad. So that's probably since we are brothers. So yeah. So what I'm supposed to say is EASA, the European Aviation Safety Agency, is the same as Transport Canada. has a requirement when it comes to single pilot operation. The baseline for EASA is, for example, at that night HEMS mission or IFR mission should be done by two pilot system. But if we work towards ensuring that the HEMS technical crew member has an equal training, then you will get equal level of safety. And that's the reason why we are allowed to fly HEMS mission during night IFR, and so on. So in our system, the HEMS technical crew member is defined as a pilot monitoring. I'm not a pilot flying, but I'm a pilot monitoring. I will talk tomorrow more about what we are doing. And this is actually equal level of safety. And that's also the interprofessional practice that we try to learn, that the physician learn me stuff, I learn the physician stuff, we learn the pilot in medical stuff, we learn the pilot in rescue stuff. So we have equal level of safety all the time. So, yeah. So Norway, we have, as I mentioned, a really long coastal line. The weather is a challenging factor. 1 of 10 missions in Norway is cancelled. It's of course more during the winter time. And because of this, all our helicopters are IFR certified, and the pilot and the HEMS technical crew member are all certified to fly the IFR mission, and we fly a lot of IFR mission. IFR mission is, for you who doesn't fly, is that we all fly when we don't see anything. And today we have 100 company routes or IFR approaches. But our main primary goal is, of course, to bring the hospital to the patient. That's the founding father of the Norwegian Air Ambulance, was to bring the hospital out to the patient. So we do primary and secondary missions. That's what we call it. The secondary missions can be transporting ICU patient to a higher level, or we can be transporting newborn in need for critical care in incubators. In combine all the bases in Norway, we fly between 8,500 and 9,000 missions each year. What we also do in Norway, we do rescue, and what the kind of rescue we do is that we do avalanche rescue, we do rescue on glaciers, whitewater rescue, ground rescue in mountain and urban environments, and we do what we call rope rescue operation. That's where we attach the rope to the belly of the helicopter, and we fly the HEMS technical crew member to the patient who is stranded, but we cannot land beside them. But now is the important part. So in aviation, this is a nice picture of, I don't know what kind of helicopter it is, but it's 2 engines. So in aviation, safety is built on redundancy. Helicopters, they are designed with multiple systems, 2 hydraulic systems, 2 engines. The aircraft can fly no problem with 1 engine, but when one starts to fail, the other carries the load. In our service, the other carries the load, and in our service, the point is that we are the redundancy for each other. For me, interprofessional practice means sharing the workload before someone reaches their limits. It means recognizing when a colleague is under pressure and stepping in early, not only for the team, but for the patient. So our goal is to prevent small weakness from aligning into failure, to close the holes in the Swiss cheese before they ever line up. So, I was now on. So, sorry, I just need to buy translation, so it will be correct. So, working in an interprofessional team is highly team-based environment. We have a shared responsibility, mutual respect between professions, trust built through training and missions. So working in Norwegian HEMS, you quickly realize that no single profession can solve the mission alone. The physician brings advanced medical expertise, the pilot manages flight safety, and me as a HEMS technical crew member, I often bridge the operational and the clinical sides to solve the mission in the best manner. So what makes the system work is trust, knowing each other's strengths and limitations, and communicate openly under pressure. So how is it to work alongside physicians? When you're working alongside a physician, you have a constant clinical dialogue, You try to anticipating needs and the next steps. You support the physician in decision making through practical experience, because sometimes we have a young physician at work and they need some advice on practical stuff, on how we have solved missions before. And also that we have shared situation of awareness. So the relationship with physician is, for me, is a very close relationships. Over time, you try to develop a shared way of thinking, probably have some different point of view. So often as a HEMS technical crew member, my role is to anticipate and preparing equipment before it is requested. For example, if you have a critical patient and you're intubating the patient and the physician is trying to intubate and you see, okay, this is not functioning, you're already going to the next phase and the physician hasn't thought about it, but you see it. That's to anticipate the next steps. And maintaining safety while the physician can focus on this complex care that the physician is doing. But this is an important issue that we are trying to manage, is that you cannot take the anticipation for granted. All the time, we have to challenge each other in the team. It's less about the hierarchy in the team and more about complementing each other. So, and you guys have talked about different special missions. In Norway, we have different teams doing different stuff. It depends on the basis. In Norway, we have 4 health communities, and the experience is where is the health communities. It depends on how many people lives in your health region. So for example, some incubators, they have their own team, but another base just do it by themselves. If you're going to pick up an ECMO patient, then you pick up the ECMO patient and you have a person with you who runs the pumps. That's it. But another team can take a surgeon with them because they are putting the patient on the ECMO. So, but if you take Reboa, what we did a study now in Norway, that was finished last year, sorry. The Reboa study for us was not on hemorrhage, it was on cardiac arrest. The thesis was that if you block the aorta, you will have more filling during the compression. So that was the Reboa study that we did in Norway. So it was a lot of training. So when we do these advanced missions such as Reboa, the level of complexity increased significantly. These operations involve multiple professional groups because we work with ground ambulance also. They need to understand when we do CPR that this is a part of the study. So we have to teach all the ground personnel also, and that we're using highly advanced equipment. So for me as a HEMS technical crew member, the role often focus on logistics, safe patient transport, equipment management, following procedures and creating the conditions that allow the clinical team to work safely and effectively. So, and in these advanced procedures, we also really, and this is a crucial thing in Norway, rely heavily on the pilot. So we try to incorporate the pilot in all the studies, all the really difficult procedures, because he can be like sitting on our shoulder, looking on how we are doing stuff. And so the pilot plays an essential role in ensuring that the operation is conducted safely. So we see that critical interprofessional cooperation is, without it, the mission cannot be carried out safely. So how is this interprofessional the benefit for the patient? I will say we make faster decisions, we have better patient care, or safer patient care. We have better continuity from the scene to the hospital. We move faster, and the reduced risk of error is less. So for the patient, teamwork means that care starts immediately and continues smoothly during transport. Different perspective reduce the chance of the tunnel vision. When everyone contributes with their expertise, decisions are often better and safer. So a lot of the time when we do special procedures, we can have the pilot actually tapping us on the shoulder and say, okay, look at the time. Should we continue with the procedure or should we just move on? Because we get the tunnel vision. So what's the benefits for me as a HAMS technical crew member in interprofessional teams? I have a shared workload. I get, as I said, the equal level of safety. When we do rescue mission, I have people ask me, when I do the belay station, is the belay station okay, or is it safe or not? It's a continuous learning process all the time when we work together. You get, of course, increased confidence when you experience from another mission to another mission that actually what you learn and what you are contributing to into the team boosts your confidence. I will say for the physician side, they will get operational support. We will help them. We will improve safety. And I think we'll better focus on advanced care. So interprofessional practice benefits actually everyone. And as a HAMS technical crew member, I learn constantly from the physicians that I work with, and of course the other clinicians, because we do inter-hospital transfer. And we move to a smaller regional hospital to move to the university hospital, and you see the difference in the challenge they got, and you learn from them. And it's vice versa, because we give a lot of experience to doctors also, because it could happen that I have experience with a disease or a critical ill patient that the physician can learn from me. So what kind of clinical skills what happened now? Oh, sorry, press the red wall. So what kind of clinical skills can I bring to the patient together with the physician? We have the patient assessment and monitoring will get smoother. I can contribute to airway procedures and assistance. We can take care of more patients because I'm also confident in doing trauma care. And if you have an accident site, my main role is, of course, also to have the safe movement of the patient and also what we call packing of the patient. As you have here in Canada, we have a famous word called hypothermia, and that's, for us, hypothermia is all year round. So the packing of a patient is critical, and it's not only the trauma patient, it's critical for the medical patient. A lady who is 80 years old who has a infarction or a cardiac, it's really important that they also doesn't get hypothermia. And of course, that we look at the operational safety during the treatment. So for a HAMS technical crew member in Norway, the clinical contribution is often about the integration, because we work with ground ambulance, we work with the fire brigade and the police. So combining medical tasks with operational demands. So while assisting with airway management or trauma care, the point of me and, for example, the pilot is to think about aircraft safety, space limitation, and how to move the patient without worsening the injuries. So the reality of interprofessional, the role in Norway as an interprofessional to be a part of the team, is to understand that we have limited time because of the change in weather. We have unpredictable environments. We need to prioritize to get rid of the tunnel vision. And also, we cannot train for everything. A lot of people think that we can do everything, but we cannot do everything. So one important lesson from Norwegian HAMS is accepting that we cannot do everything. The environments that we work in are unpredictable, and training time is limited. That makes teamwork even more important. And we try together to compensate for the individual limitations. So again, the engine to be the redundancy for each other. So just a key reflection. So I will say, and it seems like, it seems like the two other speakers also, it's probably the strength for an interprofessional team anyway. It's not one profession, it is the team. That is the strength of interprofessional. And for me, as being a HAMS technical crew member, means being both a clinician, an operational specialist, and interprofessional practice allows us to combine different expertise into one functioning unit. And this is all have to do with patient safety, patient care, and get the best outcome for the patient that we are trying to treat.